Pharmacist, I have a patient that needs consultation.
All right. Hi, Mr. Yazdi. I'm Jason. I'm the pharmacy intern on duty. And I'll go over the medications with you. Do you have any particular questions about this medication?
Yeah, I just started on this inhaler a month ago, but it seems like it's not helping that much. My symptoms are not getting any better.
Oh, okay. Well, I'm sorry to hear that. Let's go over the medication together and see what we can do to improve your symptoms. What did your doctor tell you this medication is for?
It's for COPD.
Okay, well, that's correct. The Anora Ellipta is a prescription inhaler used long-term to treat COPD for better breathing. It contains 62.5 micrograms of the imeclidinium bromide and 25 micrograms of the vilanterol triphenytate, which work together to improve lung function. Some patients may have difficulty using this inhaler. Would you mind showing me how to take this medication?
Sure.
Thanks for showing me how to use the inhaler. I think we found the reason why it's not working for you. That's one of the common mistakes that people make when they use the inhaler. I'll demonstrate the proper inhalation technique for you. First, you slide down until you hear a click. Right? If the counter does not count down until you hear the click, the inhaler will not deliver the medicine. And then your inhaler is now ready to use. While holding the inhaler away from your mouth, breathe out fully. Do not breathe into the mouthpiece and do not put your hand over the air vent. Take a long, steady, deep breath in through your mouth and do not breathe in through your nose. Remove the inhaler from your mouth and hold your breath for about 3 to 4 seconds or whatever is comfortable for you. You breathe out slowly and gently, and you may not taste or feel the medicine even if you're using the medicine correctly. Is this clear?
Yeah. Thank you for your explanation. I've been using this inhaler incorrectly all this time. For the direction-wise, I've been taking this inhaler first thing in the morning once a day. Is that correct?
Yeah, that's correct. It's good that you're taking this inhaler at the same time every day. The adherence is a key in treating COPD, so keep taking the medication at the same time every day, but do not take more than 1 dose a day. This inhaler expires in 6 weeks after you open the foil tray. Store the inhaler at a room temperature in a dry place away from direct sunlight. The common side effects are sore throat, sinus infection, and lower respiratory infection. However, if you have sudden breathing problems immediately after inhalation, stop using the medication and call your healthcare provider right away. Do you or your family member have asthma?
I don't, but my son has asthma.
Okay, well, just for your information, this medication is only approved for use in COPD, so do not share this medication with someone with asthma since it may worsen asthma problems. This medication also should not be used with any other long-acting beta agonists such as the Ceravent Discus or anticholinergics such as Spiriva. Well, according to your profile, you're not taking any other long-term COPD medications. Is that correct?
That's correct. But my doctor prescribed ProAir to use for my asthma attacks. Is it okay if I take this along with the Anora, or take that along with the Anora Ellipta?
Okay. Yeah, that's okay. The Anora Ellipta is only to prevent COPD exacerbations. The onset of action is about 30 minutes, while the peak response will show within 6 hours. As you can see, it acts too slow to be a rescue inhaler. Always have a rescue inhaler, such as ProAir or Ventolin, with you when you treat sudden problems. In addition, it's important to have regular follow-ups with your healthcare provider. At each visit, the physician can assess the symptoms, comorbidities, and risk factors. In that way, we can check your lung functions and see if we could discontinue medications properly. Now, that was a lot of information. Can you briefly tell me why adherence is so important?
Oh, yeah. It's important because this medication is a long-term med to prevent COPD, and it helps reduce symptoms.
Well, that's correct. As I previously mentioned, adherence to the Anora Ellipta will help improve lung function, symptoms such as dyspnea, frequency and severity of exacerbation. So it's really important that you take this medication at the same time every day. As you probably already know, the best way to improve these symptoms is to stop smoking. Smoking cessation works better than any other medications, so please let me know at any time if you need help to stop smoking.
Okay, I will.
All right, well, here's the medication guide and link that will show you how to use the inhaler. If you have any questions, please feel free and stop by and ask me questions.
All right, thank you.
All right.